tell us, Anne-Marie will tell us more about the scheme. So I will just get the nice pleasure of introducing Anne-Marie. So those of you who don't know Anne-Marie, Anne-Marie is a professor of applied health research in Leeds, and also the Pro-Dean for Research in Leeds, and has done more for this country and probably internationally in bringing underrepresented disciplines into research and into academic careers than any other person that I can think of. Absolutely sort of landscape changing activity in her previous role at the NIHR Academy. So one of the amazing legacies that Anne-Marie is leaving as she's stepping out of the NIHR Academy is the Senior Clinical Practitioner Research Award. So Anne-Marie, over to you. Thank you so much for giving us time and telling us about the programme.
Nina, thanks so much, even though it's highly exaggerated. Thank you. So one of the things that I'm most proud of is just step down from Associate Dean at the NIHR Academy and have been, which has allowed me to do a number of different things. But one of the things is try and champion health and care professionals, and that's really who NHIRSCPRA was designed for. So let me go through my slides. Just need to get something off my screen. Okay, so I'm the co-chair of the, with Walter Dillo, the co-chair of the SCPRA panel. And can I first and foremost apologise for the appalling acronym, but this was all done at speed. And it is absolutely what it says on the tin, but it doesn't make for an acronym that slides off the tongue. So Nina and Annette from NHIP are on the panel as well. So we have a strong representation from Newcastle, you know, who live and breathe this. So I've got the delight to talk a little bit about the background of the scheme, some of the changes that we've seen in the second round, and then we'll hand over for questions and for Nina and Annette to talk about what, you know, their thoughts around this too, and then some questions. So that's great. So if we talk kind of a little bit about where this came from, so we were able to convince Department of Health and Social Care that we've got a huge group of people that represent a large portion of people within NHS and social care, but are disproportionately represented in terms of clinical, academic and research careers. And they're the healthcare professionals. So particularly around, so nurses and midwives make up the largest proportion of people within the NHS. But there's also allied health professionals. And if you have a look at the proportions, it is quite significant. And we undertook a series of summits that were looking at why do we have such poor representation for nursing and midwifery and for allied health professionals. And we kind of identified a whole lot of areas. So there were problems in the pre-registration. We know that our we've got very packed undergraduate pre-registration courses, and research seems to have been kind of pushed out of it. And the research is kind of often presented as stats, and it's hardly inspirational. It's hardly why you sign up to do a health care professional course. So we know that there's a poor understanding of research and lack of visible role models in the undergraduate pre-registration sphere. There's very little options around seeing in research, and particularly they'll often associate research with just being in universities. If we're talking about mid-career, where there's limited opportunities and pathways, and again, there's the issue around you know, opportunities. And then if we're looking at advanced careers, we see constantly, time and time again, because there's not a funded pathway, that often people who do PhDs, particularly at the NHS, when they go back to their NHS job, go back to their NHIRSCPRA roles, and they're lost to research, which is a real missed opportunity. So let me just... Sorry, I've just got something coming up on my screen. I need to hide that. Brilliant. Okay, so and apart from that, apart from the poor, the lack of role models, there's limited signposting. So if you know, you're lucky to have the NHIP Academy. So that brings, it's a great resource for bringing kind of information together and helping people to signpost to different opportunities, to networks and to other infrastructure. And we know that there's a real lack of recognition and career development in terms of particularly research delivery staff. And that's a huge hole. So it's not just about developing a PhD career. So what we were able to do is we managed to convince Department of Health and Social Care that we had some solutions. And so in terms of the undergraduate pre-registration, so you hopefully will know, Annette leads the Insight program for the North East. So we've got an Insight program that's around trying to promote and profile undergraduate pre-registration opportunities. We've had doctoral fellowships, so we've got a number of different investments, so we're able to get more like fellowships, more pre-docs. We've got credentialing masters opportunities for delivery staff for credentialing. In that postdoc career, there's the Development Skills Enhancement Award. We've increased those. We've got in-practice fellowships, and that's particularly to try and promote. And again, as Nina was saying, a big part of this is trying to get people in who currently aren't necessarily involved in research in terms of community and primary care. We're really looking at community health visitors and community pharmacists. And then there's a pre-application development award. In terms of the advanced career, we've absolutely got, this is where the Senior Clinical Academic Partnership Award fits in. So this is what we're here to talk about. Okay, sorry, this thing keeps popping up on my screen, which stops me from seeing my slide. That's better. So in addition to that, so this is absolutely around health and care professionals. But there's also, and by health and care professionals, we're talking about the collective noun, which we've actually managed to socialise, for nurses, midwives, allied health professionals, healthcare professionals and pharmacists. So at the same time, we've got a real crisis in medical clinical academics. We know that around about a third of the current clinical academics are in retirement age. And we know that we're not attracting the same doctors into clinical academia, and that's going to lead to a huge fall off in clinical academics in terms of medicine and dentistry, but particularly medicine. So what we developed was this, it's kind of like the new generation hefty senior clinical lectureships, if any of you are old enough to remember those, that were developed for doctors and dentists. And it's around giving you funding to go and do research rather than having to have a fellowship. So the Senior Clinical and Practitioner Research Awards, NHIRSCPRA awards, are for registered healthcare professionals, but also medics and dentists who have a PhD. And the reason why it was opened up to medics and dentists is that when we went to Department of Health and Social Care, we asked for 75 of these for healthcare professionals, and they thought it was such a good idea. This is over a 5-year period. They thought it was such a good idea that they gave us 75 a year over 5 years, and there's no way health and care professionals could fill that, I don't believe. But so it is opened up for underrepresented medics and dentists. And we'll talk a little bit about that. But it's really to encourage those to return to research. So those that have a research qualification but currently don't have the capacity or ability to do research in their current role. And we're hoping that this is going to focus on those in the NHS and care settings. But it may not, what we also see is, particularly with nurses, that often they will take up an academic role and be consumed by teaching. And so this is a way for them to also get back into research. So in terms of underrepresented disciplines, we're talking about the health and care professionals, and everything in red is something new from the round 2. And it'd be fair to say that round 1 was developed at pace, and there were a lot of things that we wouldn't do the same. So there's some changes, but the general philosophy of who we're trying to support has remained the same. So underrepresented disciplines, obviously, NMAPs, dentists, GPs, they would say, but healthcare scientists and pharmacists. And we're also looking at underrepresentation in terms of characteristic and circumstances. And so we're talking about, gender, discipline, ethnicity, and importantly for us, geography, because we do know that there's a huge difference between the England kind of south versus the rest of the country, where the research funding goes, particularly in terms of fellowships and particularly in terms of postdoc fellowships. And this is really important. And when we did the scheme last year, we were absolutely delighted to say that, we had a good geographical spread, from, particularly from the north. So I can say that Newcastle and the northeast were very successful, as were Leeds. And that's incredibly good thing. So they're what they are. So up to 75 awards per year, and it's up from 20 to 50% of your salary for up to 5 years. There's a maximum of £5,000 a year for training and development. It was a blanket 20,000, and we saw people doing really stupid things, putting in some really wild and wacky things, because I think they thought that they needed to spend it. But what that 20,000 a year to do was for some disciplines, and particularly possibly healthcare scientists and some of the more lab-based medical professions, is that they often need to produce a pilot data to actually go on and if they're going on to do another fellowship. And so we tried to clarify that you can have up to £20,000 a year for small projects costs for pilot data, but this is not to fund a project. Okay, it's not to fund. It's not like a cheats way of trying to fund a cheap project. And importantly, for those of us in universities, this is important. It's FET covered. So there are a number of awards in this space, and so looking at which one that you should do is so the NHIRSCPRA is there to support people, and it's really around people who've been lost to research, so bringing them back in. And it doesn't mean to say, what we usually find is people continue to do research even though they're not necessarily funded. You're absolutely eligible to apply, but what we're not talking about are people who are in positions or on fellowships that actually allow them to do research. But the other two awards, so there's the MRC NIHR Clinical Academic Research Practitioner Awards. So they're the CARP. What we've found is that they've been they target a similar group, but they're really around a project. And you need a good project. And I think there's only been one healthcare professional, even though it's opened up to in the whole time that it's been running. So we know that it's not really fit for purpose for healthcare professionals. And then we've got the advanced fellowship. So the difference with all of these, if I can highlight it, the SCPRA is on underrepresented disciplines, and this is around levelling up, really important in terms of the disciplines, professions, geography, gender. It's around a wide remit within NHS and care settings. As compared to the CARP, so the CARP is around a very strong, and it's a really strong emphasis on university partnership, and it's expected. So the award actually goes to the university, not to the trust. And so that it's quite different, and you're expected to do quite a developed project. And then the advanced fellowship is the kind of jewel in the crown. That's kind of, and we're hoping that some people will be looking to get their SCPRA to work towards perhaps a CARP, but particularly an advanced fellowship. So that exactly might be what you need, and particularly if you're stuck within the NHS and you don't have time to do the necessary things to develop an advanced fellowship, then this scheme is for you. But the SCPRA buys you out time for you to develop collaborations and to develop things. The advanced fellowship is much more generous, because you get your full salary, you get your research costs, you get training costs, and your personal development awarded. So what the scope is, that they're looking at kind of, leading research projects. So you might want to buy your time out to develop a HTA application, a program grant, or other types of research applications. It may be around preparing for fellowships. It may be around undertaking strategic leadership roles around delivery. But it's not to fund delivery, because that's already funded by the CRM. So if you go down that route, it's really talking about innovation in research delivery, particularly around methodology. Might be around identifying research priorities in a particular area, knowledge mobilisation, so implementing, again, that may be really important to your trust. There's all of this research that's out there, but you're not actually getting it in. That could be good, or it may be kind of undertaking, in as well, it might be around undertaking training that will transform, so that you're able to apply for a project or a fellowship funding. So what's knowledgeable? Time to do research. So just the idea of time out and I'll do some research. It needs to be targeted in terms of the NIHR priorities. Research delivery, as I've already said, it's not available. Activities that are already covered in your current role. So if, for example, you have some funding in your role to do things like research development or academic capacity development, then you're going to have to do something different to that. And certainly, obviously, things that are not within the NIHR remit. So this is the assessment criteria, and as I said, underrepresented specialisms we're really wanting to hear from. But obviously, it's still around quality and appropriateness of the research and research training. Where you're doing it and who you're partnering with are really important. So we're wanting to see strong statements from your employer about how you're going to be supported and who you're going to be working with, so your collaborators. And we want to see a trajectory. It's the idea that you're just kind of going to do research and just going to do things. And we want to see that it's a step change for you in your career. And given that the group that we're looking at are people who've been lost to research, I think that should be a fairly easy thing to look at. We really want to hear what your arrangements are for protected time. So we want to hear what your current workload is and what your current job is, what you're going to be doing for the project, and how you're going to be, how that's brought out. So it won't be enough to say the hospital will cover you. We want to know how they're going to cover you, because we're expecting that you're going to be in either to middle management, middle career or senior roles, and replacing you may actually be quite difficult. So we need to know how. We need to know that and see evidence that there's commitment, not only to your own personal development, but committing to the community and committing to developing others. We want to see from the host organisation evidence of track record and ongoing support. So what's going to happen when you finish this time? Obviously, value for money, and we want a statement from your academic partner where relevant. And we're kind of assuming that most people will have an academic partner, but you may not, particularly if you're kind of focusing more on innovation in research delivery. The application form is an application that's formed through the Aramis system. And this is all of the things that are in it, and it's a very light touch form, because we know that by definition, if you don't have research in your role at the moment, you're not going to have a lot of time to pull this together. So I think you'll be surprised, and one of the comments that we had back is that there's not a lot of, the word limit isn't great. And that's because we want it to be light touch. It's not kind of a full fellowship. So clearly you need to log on to the RMS application system. And what we'll be looking for in terms of a CV is that you'll obviously pull down all of the information around roles, around grants, etc. But we're also asking you to describe your career to date, and we're expecting your career to date won't be normal. You're not going to be one of these people that's gone from fellowship to fellowship, more in that kind of academic route. So it's absolutely fine for it to have gaps. And really importantly, contextual factors. This is critical if we're looking at engaging underrepresentation. It's also critical if there's big gaps and we've got questions and that we don't know, things kind of look a bit odd. If you can explain why they look a bit odd, whether that's through you've had caring issues, or whether that's through illness, or whether that's just through a career change when you kind of you're having a bit of a confidence of crisis around whether or not you wanted to, who you wanted to be and what you wanted to do. It's up to you how personal that you put. Some of these things are obviously very personal, but it is absolutely, if you need to advice around, you don't want to divulge too much, but you've had some, significant personal issues, that's okay. As long as it flags that, that there are these factors. Now, your proposed research activities need to be strategic. They need to be in line, obviously, with the NIHR mission, and that's around the improving the health and the wealth of the nation through research. And it would be incredibly wise to look at the NIHR's areas of strategic focus. So there are these areas, they're on the NIHR website, and what you should be looking at is making sure that your projects speak to one of these areas. And you can see that they're fairly broad areas, but the more that you can kind of say, look, and it's talking back to the NIHR, you think this is important, well, I'm going to provide an example of how you can actually, if you support me, I can kind of address some of those priority areas. And they need to be done, they need to obviously be high quality. So if you're going to be doing any kind of research methodology, who are your partners? Who are the people who are going to support you in doing that? So importantly, the training and development that, and again, this is one of the only times in your life you'll get paid to do training and personal development. So make sure that you're kind of ambitious around that. In terms of collaboration and report, sorry, I've got a typo on here. The first one should be you can nominate at least one and up to 3 individuals who will support. It should be research support. So we'll provide support and mentorship for the research. Now, they're going to have to be relevant to what you're saying you're going to do. And this is where academic partners often come in, but it may not necessarily be an academic partner. There's also a section for practice support, and it's kind of at least 1 and up to 3 individuals who provide professional mentorship for you. Now, if we're talking about people who are quite senior, and it may not necessarily be someone from your own profession, or it might be someone who's just that little bit further ahead in your profession in terms of their kind of research activities. It's to encapsulate people who potentially need developing kind of their combining clinical and research activities together. So what we've found is that often only one person is needed, but again, it will depend on your circumstances. Okay, obviously the budget needs to be identified, but it's not a heavy duty, but value for money is critical. And there's important, you need a host administrator identified, so you need to let them know, and head of department, and they'll require a host letter of support. And one of the things we've learned is if you're going to do this, it's around managing things. The NHS is tough at the moment. HEIs are tough. And if you're kind of wanting to kind of reduce your hours, you need to talk to your line manager as soon as you can. And I think your you're the person who knows your job better than anyone else. And what I would absolutely suggest is that you frame it in terms of how will, if you're away for, a day a week or 2 days a week, what will this mean in terms of the impact on the clinical services? They'll get money to backfill your salary, but often that's not that straightforward. So know your role and come up with some solutions from them and put it in the context of how it could help the clinical service and how this might address their needs. Certainly, so I work a lot with managers, and often people talk about line managers being the problem. My experience is line managers are often really keen, but just don't know how to help or don't know what to help. And we've also had, and I'm assuming that post-doc, we're talking a different community, but when people just kind of go and demand to their managers for support, that's kind of not kind of terribly intelligent. And it's around kind of making this, flagging with them and coming up with some solutions, particularly in terms of how this might help the service. Talk to your NHIP team, your Trust R&I team, and I'll hand over, and I know Amy, Nina, etc. will tell you more about how to do that. The closing date, it's not the 28th of September, it's the 28th of November, sorry. Anyone think I pulled these slides together very quickly? And for a starting date of between the 1st of May and the 30th of September. So your managers will need to know that. So it's not a lot of time, but we're hoping that people will be aware of the scheme, and if you're interested in it, you will have thought about some of these things. Okay, so that's kind of it in a nutshell, but I'm sure Nina and Annette would be happy to talk about their experiences.
Thank you, Anne-Marie. That was super, super helpful. Even though I was on the panel on the first round, I still learned more from that. So that was really, really helpful, Anne-Marie. I might just ask one question and then I'll hand over to Annette. That sort of the table where you showed the differences between the SCRPA, the CARB, and then the Advanced Fellowship, and thinking about that clinical or practitioner and research interface, would you say that it's always about sort of trying to increase or get back into the research, or is it more about navigating that boundary? Can you just elaborate that a little bit more?
Yeah, so I think we need to put our a big part of this was not just having it as everyone being clinical academic, and supporting our research delivery ambitions as well. So it's critical because this is a senior postdoc role, and the ambition should be associated with that. And I think it's really important to have a look at where your ambitions are. So if, for example, you want to be a clinical academic, like Nina, then the best way of doing that is an advanced fellowship. Okay, that's a clear route to becoming a clinical academic with both clinical and academic commitments. So the idea would be to put in for a SCRPRA, say maybe for 12 months or 2 years, to give you the time to apply for that award. If you're what we like to call an academic clinician, it may be very different, that you might want to do a research for patient benefit, stay within the NHS organisation, but still be research active, but use this time to fund research activities within a service role. And I think that's often important, particularly for healthcare professionals, that's an option to do. So it's having that clarity of your long-term goal.
That's really, really helpful. Annette, do you want to come in? And please do drop in questions to the chat and we'll pick them up from there.
To be honest with you, Nina, I think it's been really comprehensive from Anne-Marie, and I think it's just a really lovely overview. I mean, what I would say is, this is a fantastic opportunity, and certainly seeing the first time round being on the panel, we saw a wide range of applicants, didn't we? And there's lots of opportunity. This isn't a one size fits all. This is it's an opportunity for lots of different individuals to apply for some time and space to forward their career in research. And that's really been long needed, because so many people have said get to their doctoral stage, postdoctoral, and then are stuck, both either in clinical practice or, as you say, moving into academia. So I think this is a real fantastic opportunity for those individuals to think about research going forward and capitalising on that. So I think we should just throw it open more, Nina, to see what questions people have for us.
Brilliant. And I think, Anne-Marie, you already emphasized that point, that the section on contextual factors is really, really important. And I think that really can't be overemphasized. It's often because we know our journey and we know what's happened to us, and we know how difficult or challenging it might have been for people from our background or from our discipline. We kind of think that everybody knows that, but on the panel, you've got a wide range of people from different backgrounds, and it's not a given that everybody knows that. So you really need to articulate it. You don't need to labor every single twist and turn, but you do need to outline the key challenges and the impact that they might have had, and why your career to date has maybe looked a little bit different. So taking that diversity of journeys and actually turning that into a positive, and saying why it makes this award right for you. So questions. We've got a question from Heather. Can you say when you would advise applying for the pre-application support fund first before applying for the SCPRA? Anne-Marie,
yeah. So SCPRA isn't a fellowship; it's an award. So I wouldn't advise to apply for a pre-application support for this. It's also light touch. It's deliberately light touch. So just jump in and apply for SCPRA. People, when you put things in place, they think that they have to apply for everything. No. Just jump in. What the SCPRA would do is, if you really knew that you wanted to do a fellowship, an advanced fellowship, then apply for the pre-application award, if that's what you want, or the SCPRA. But don't think that you have to apply for the pre-application before SCPRA.
Yeah, and from the panel, I would definitely agree with that. It would be hard to see how that sort of sequence would make sense. The next question is, thank you for this. It feels that medics seem to be less, oh, the question's just moved up. It seems that medics, sorry, that moves up, seem to be less of a priority in this round versus the first round in terms of the way the information is on the website. Is this a misconception?
So nothing in terms of the proportion. So we expect to fund at least 60% health and care professionals compared with medics, and that hasn't changed. So I think what has changed is we had, unfortunately, I can't remember whether we had any applications from pharmacists and healthcare scientists, which is why they've been highlighted. GPs are classic. They continue to be a priority for us. So absolutely not. I think the issue is that this funding came from the health and care professional initial funding. So that's why it's targeted, and it was opened up to medics. So absolutely medics. And I think it was 68% went to health and care professionals last year. Something like 64% to women. Geographically, it was incredibly well spread. I think only 40% went to London, but again, that's the purpose of it. So if you are, I would absolutely please apply if you're medically qualified. What you're going to have to do is explain why you're an underrepresented group, and that's really easy. If you're talking about geography, lack of opportunity, so if you're an Imperial and a cardiologist, you're on a machine. And that's what we find with CARP panels, that all the CARP panels fund doctors who are in MRC centres. So no, it hasn't changed but please consider the underrepresentation.
Thank you. Next question, which has also gotten sort of thumbs up from others. So a popular question. If my role already involves a research element, I'm university based, so they want me to do less research and more teaching. So would this be suitable, or am I perhaps better looking elsewhere based on your points about bringing people back into research? And knowing who's asked that question, I'm sort of wondering if it would be just worth talking about that balance, or that sort of what's that connectivity back to your clinical or your practitioner base?
Yeah, so we absolutely know that health and care professionals, if they go down the academic, into a PhD and they'll go into an academic role, will get drawn into teaching. So even if you're in Leeds, we use the TSR role, teaching, scholarship and research. What we absolutely know is you're supposed to be doing research, but teaching takes up a much greater proportion. And particularly at the post-COVID, that was absolutely terrible. So I guess it's making that, that clear, that you're not, and again, even if you're doing a little bit of research now, and it goes back to even if you're in the NHS and you've been managed to kind of keep on doing some research because you have, or you've had a day, half a day a week. We're looking at kind of trying to re-engage you. So we'd also be looking at what your destination would be. So what do you want to do if you're staying at the university? And I would think as a university person, it would be for an advanced fellowship.
And I think some of these questions, I suppose this is sort of reflecting those unique balances and career journeys as well, because I can see there's other questions about that sort of the combination of teaching, research and practice. And if you're unsure about how to balance that, do come back to the NHIP Academy, have a chat with Amy. Amy's on the call, so Amy can put camera on and give a wave, have a chat with me or Annette. And if you're still stuck, if we can't help you, we will always help you to connect back to the NIHR Academy and clarify your individual circumstances as well. Can you advise how much previous funding is expected? When I have looked at fellowships in the past, it feels like you can't apply until you have strong history of securing research grants. I have lots of research experience, but a lot of it has been done unfunded or in previous roles where I was already fully funded.
There's no expectation of research funding. You might have it, and that's great, but we're talking about people who may have, but explain how your research has been funded. So if you were previously funded, explain that. But where this scheme is for people who have done their PhD and then have gone back to generally the NHS, and they're lost. So we know but just put it in the contextual, your career to date, and put it in the contextual background around, because we know that you're not likely to have pulled in grants. And I'd just like to again emphasise this isn't a fellowship, so we don't have the same expectations. What you might want to do is use the NHIRSCPRA to develop funding, but then you might apply for a fellowship.
Thanks, Anne-Marie. Next question. This is a sort of a slightly change of tact, a bit more away from that individual career pathway and thinking about, I suppose people are increasingly combining different types of research on that sort of discovery, translation, application trajectory. So there's a question, what if the plan for an advanced fellowship is around discovery, which the person recognizes outside the remit, but then they would like to first propose the NHIRSCPRA application to put the relevant groundwork for successful fellowship. How would that fit?
Yeah, so anything that you're doing within the NHIRSCPRA has to be within the NIHR remit, but if you're wanting to use this to apply for a Wellcome Fellowship or an MRC Discovery Science Fellowship, that is encouraged, but you'll need to make that clear. If you're talking about some discovery diagnostics that involves animal research and you need to do some of that within your SCPRA, unfortunately, no. Because of DHSC, they're so sensitive about that. So advanced diagnostics, yes, not a problem. But you might be looking at a different destination for a different funder. And just make that clear.
And it might be worth flagging here also for people's attention, in case you haven't seen about the advanced fellowship, that is more sort of combining the translational and discovery elements. So, you know, again, have those conversations with us, because there is now the EME Advanced Fellowship as well. So again, you know, these things move and change. A question back again on the careers. Do you need an NHS contract or partner if you're employed by the higher education? On round one, the answer was yes. That still remains yes. NHS or a practitioner contract.
So I would expect if you're employed by HEI, I would expect you to have a partnership with some provider organisation. That would be very, for this scheme, if you're talking about developing your skills, then it would be very odd if you didn't.
Yeah, so an under a contract partnership kind of thing doesn't necessarily need to be the main employment contract.
No. And it could be that you may not have it now, but if you get the award, you will have it. We need evidence of that collaboration.
Yeah. A follow-up question, which I think is a really interesting one, and there was quite a lot of variation, certainly on the round one. I would like some guidance about how focused or broad the research activities can be. I'm considering applying with a raft of research activities, i.e. some knowledge mobilization plus writing for an RFPB plus some proof of concept work. Anne-Marie and Annette, do you want to comment on that?
Annette or me? Annette, are you happy?
Yeah, I'll start off, Anne-Marie, and then you can probably jump in as well. I think what we want to do see is actually a cohesive plan for your research activities. You know, if they all join and link together, then that's fine. But what you don't want to do is see somebody being a scattergun approach, because you want to be concentrating your focus, because what you're hopefully planning on doing then is looking for your next fellowship award, you know, and if you've got a scattergun approach, then you're not going to be competitive for your next award. So it is important that they do join up together and they are meaningful together. So there do need to be some sort of cohesion between activities that you're planning on doing. Anne-Marie, do you want to add anything to that?
Yeah, it's a very brief form. So you need to be strategic in the words that you use. So what you want to do is to provide enough detail that you've thought about, you know, how you're going to use your time, what you're going to apply for, what are the outcomes that you're expecting, and so therefore that this award is detailed. But it's not a project. There's not a project area where we're going to be requiring sample size calculations and detailed PPIE engagement. It's absolutely not that.
If you're working part-time clinical, can you apply for grant to top up hours so that you have time for research activity not possible in clinical time? That's what I would understand the whole of the SCPRA award to be. And then obviously during the SCPRA award, you can apply for other awards that then build on that opportunity that fellowship or the SCPRA award provides to you.
So yes, you can apply for funded research activities, but if you're saying, I'm part-time, but I want to increase my hours to, to 4 days, 2 days a week, but I want to do this over 4 days, you'd need to get your trust sign off to do that, because that has implications around, the on costs, etc. And if they're happy to do that, that's great, but you can't do it without their permission if that's what you're asking.
Yeah. Okay. We got thumbs up to that question, so I'm hoping that was the thumbs up to the answer. Are there previous successful applications which are available to view? So yes, you can contact us at the NHIP, and we can put you in touch with people and sort of help you to find people. And I can see there are some people on the call as well. I saw Lisa Robinson there. There might be others who were some of our Round1 successful people. So we're quite happy to do that sort of dating service to put you in contact with those who are from the Round1. Is this award open to those healthcare professionals with a prof doc?
So, because prof docs differ enormously, so you can have a professional doctorate that is a training, clinical training. So some of the pharmacy courses they do very limited research, and it's around developing clinical skills, whereas others have a fairly significant research component. So you need to demonstrate equivalence, and there's some guidance on the NIHR website about that. But the bottom line, it depends.
Okay. And I think there's a couple of questions that are probably answered in the guidance. So as a general guidance, do you always read the guidance and then read the guidance again? So most of these, the sort of quite specific questions, there's usually information there that provides a good starting point. Follow-up questions about this, how broad or focused the activities need to be. And I think this, from my point of view, having seen the first round of applications, I think it's maybe worth emphasizing that there really is a lot of variation. Again, it goes to that point that this is meant to be about you articulating why your journey has been different, and therefore different activities are suitable for different people. And like Annette said, it needs to make a coherent whole. So what you're proposing as your next destination, what you're saying you're trying to do and what you're trying to achieve, and then how you're explaining how your journey to date has maybe created some gaps, or you've come across some barriers. The activities you're proposing to do really need to make a nice and sort of credible story around that. There's a question that once awarded, is there scope to change what you end up doing, or do you have to do what you said in the application? So I think a categorical answer to the awards is you have to do what you said in the application within reason. Sometimes something becomes impossible, but you do need to know an overall plan, what you're going to do. Anne-Marie, do you want to kind of comment?
Yeah, and I want to link it to how many times can you apply for SCPRA. So you can apply twice, and then there's a period of, I think it's 3 years before you can apply again. Don't apply if you're not ready. Don't apply if you're not sure what you want to do. This scheme will be available next year. And what really irritates reviewers when reviewers are acting, they're being sought out for feedback, and this scheme doesn't give a lot of feedback. Can I just say, we don't have the capacity to. It's not like a fellowship. So don't put it in if you're not sure what you want to do or what it looks like. And if you kind of need some more time to develop, put it off for 12 months, because it'll come through, and just don't do it. Just don't.
Brilliant. Question about the underrepresentation. So this is asking, what are some strategies to demonstrate underrepresentation in the cohort of patients? And it's maybe just worth emphasizing that you can demonstrate underrepresentation in many things. One of them, which is the cohort of patients, but it's also your discipline. It's about the geography. It's about the particular area of work. It could be about protected characteristics. So it could be about something special about your circumstances. So think about underrepresentation, not just in terms of those that your research is seeking to benefit, but the broader sort of factors as well. Annette or Anne-Marie, would one of you like to add to sort of strategies to demonstrate underrepresentation?
there's so many different resources. There's the Include website. It really depends on what your question is, whether or not you're talking about recruitment, you're talking about co-production, you're talking about making sure questions are relevant. But I would say that it's an absolute priority for the NIHR that you do that and do it appropriately.
There's no more questions left. Oh, one has just popped in. I knew one would pop in as soon as I would say that. Is there an expectation to have done PPI work before applying?
Not necessarily, because we're kind of thinking you probably won't have had time. But if you're, but what you might want to do is to use that time to do the PPI to then get a funded project, and so include that in. So therefore, if you're going to do that, have you got the right collaborators so that you're going to do the PPI properly? Include that in your costings. You know, so make sure that but it's not like a fellowship where, you know, it'll be turned away if you haven't had PPI done properly for the fellowship. So it's giving you time to do the things like that that you don't when you kind of don't have a research post.
And if you know of other groups that have done PPI and have published it in that topic, or, you know, JLA priorities, you can of course cite all of that work to say this is an area that's important for the people. Brilliant. That's been a super productive session. Thank you so much for everybody who's joined us. Special thank you to Anne-Marie, to Annette, and especially thank you to Amy for setting up the session and doing all the groundwork around this. So absolutely fantastic. Please just get in touch. Good luck with the applications, and yeah, fantastic to see you all.
Brilliant. And thanks for inviting me.
Thank you for joining
Anne-Marie.
us.
Thank you, Nina and Annette.